Okay, this is my patient here, and I'm going to do a little physical assessment on my patient just to maybe help you out with your patients in the hospital. And hopefully I won't forget anything, but since Christina is a nursing student, she can remind me if I do, okay?
Okay.
Good morning, I'm Mrs. Krause, Dana Krause. I'm going to take care of you today. How are you doing?
I'm okay.
Well, I'm going to do a little assessment on you today. So first of all, let me know your name. What's your name?
Christina Seminario.
Seminario, okay. And she had an armband on. I look at her armband, make sure it matched up. And Christina, what is your birth date?
July 7th, 1990.
Okay, and I'll look and that should be correct to information. So I've assessed her to see if she's for identification. Now I'm going to assess for orientation. So I'll ask her several questions. Christina, do you know where you are today?
Yes, I'm at Florida Hospital.
And what are you doing here?
I am here for something with my stomach.
Okay, well we'll assess that in just a moment. And do you know what today's date is?
I don't.
Do you know what today is?
Yes, it's Monday.
Monday, okay. Do you have any
August.
exams today?
I mean, not August, December.
December. Okay.
Yeah, I had a final today. It's December, I think it's the 12th or 13th. I'm not sure.
All right, I believe it's the 12th.
Okay.
Anyway, these were some questions to check for orientation, and I do believe that our patient is oriented today. So I'm going to start with a little head-to-toe assessment. I'm going to start with her eyes. If you have your pen light, get your pen light, and you'll have your patient look straight ahead, and then you'll just put your pen, my pen light, no, anyway, you'll just put your pen light from the side or from the bottom, look straight out, and you want to make sure that their eyes constrict when you do that. So you can check for perla on that, and also you can check to make sure that they're following your pen light or your finger. So if you'll look at my finger and just follow it in, I can check for accommodation right there. And then the next thing I'm going to do is I'll have the patient open their mouth to check and see if the oral mucosa is pink and moist, and it is, so she's not dehydrated, at least from that. And I can also check under her chin to see if there's any swollen lymph nodes, and they feel kind of like marbles if they are. I don't feel anything there. A couple other things on skin assessment. I can check for capillary refill, and I'll press on her nail beds right here, and it should return to pink in less than 2 seconds, and hers easily does. Also, I can check for tissue turgor, which I can just pull that up, and if she's not dehydrated, it's going to return, spring back to normal just immediately. And you can also check that on the chest of your patient too. One of the first things you do in assessment is your vital signs. So with vital signs, we'll do the radial pulse. So I'm just going to find this bone right here and go over the bone, and I'll take it for 30 seconds and times it by 2 to get her radial pulse. I can also, while I'm standing here, after I take it, I can look at her chest movement and check her respirations to see what her respirations are in the minute. So you have respirations and you have your heart rate. You can also get the temperature here at this time too, so don't forget to get the temp, and the blood pressure. With the blood pressure, you will take the cuff, and the side that's closest to you is preferable. Just going to put it on the patient, and I usually put these two tubes, the brachial artery in between these two tubes, because I can hear better. And I'm going to put my stethoscope on where the opening, where these things point out, so I can hear it better. And I'll put it right over the brachial artery, and I'll hold on to it with my fingers instead of my thumb. I'm going to hold on to it like that. With my other hand, I'm going to hold this in my other hand and make sure it's turned off. And I'm going to pump it up. By the way, do you know what your normal blood pressure is?
I don't remember.
Is it average?
It's a little bit lower than average.
Okay, average is about 120/80, so we'll pump it about 30 increments above that. So we'll go up to about 150. on this little sphygmomanometer. So we're going to pump it up. And then slowly, slowly let it out. And you're not going to hear anything. When you let it out, you're just going to turn this little valve to the left. You're not going to hear anything until you get to the whatever your systolic is. And once you get to that, you're going to hear it pumping, thumping, until you get down to your diastolic. And then you'll release it. And then that will be your blood pressure. While you have your stethoscope, this is a good time to go ahead and check their heart sounds, the apical heart sound, and you can check this for a full minute to see if they have any murmurs or heartbeat skips. You can also check their lung sounds. But do you mind sitting up in the bed for just a second? So I can check right here, have them take a deep breath. Okay, and then I'll check on the other side too. And then if you'll come around to the back, I'll show you. You can check here and just slide down here and here, slide down here and here, and you may even go around to both sides like this to check. If you don't hear anything, it just means that they don't have any problems, that it's clear bilaterally and you need to chart it that way. Also, you need to check for bowel sounds, and when you check the bowels or anything on the body, first you look and then you listen and then you feel. Okay, so least invasive to the more invasive. So you'll look at the bowel area, make sure that nothing's wrong there, and then most of the time you'll take their shirt and pull it up. We won't do that in this little assessment. And then we're just going to listen in all 4 quadrants to see if there's activity, hyperactivity, diminished activity, diarrhea sounds, but I can hear normal active gurgling in all 4 quadrants. At this point, you can also ask them about their bowels. You can ask them questions such as, how is your urine? What color is it? What's the amount of urine that you have? Do you feel like it's regular? Any burning or itching when you urinate? Your bowels, are they regular? When's the last time you had a bowel movement? Is it of normal consistency? To check that. So we're going to go on down now. We're going to look at the legs and feet. I can check the pedal pulse right here. I'll just have her lift a big toe up and follow that ligament up and over to the middle. And I can feel it very strong here. If I need to, I can check and see how her strength is in both feet. So if you'll press down on both my hands and press up on both my hands, I can see that the strength is equal on both sides. You can also do this with the hands and arms, and I'll take my fingers and cross them like this, and I'll have my patient squeeze them so I can see if her grip is strong on both sides. A little bit more advanced, if you hold your hands up like this and push against mine, and then push back against them and hold them like this, and then again like this. That's several different ways to check. You can also check for neuro on the face if you need to. If you have to, you don't have to, depending on their problem. But have them arch their eyebrows up like this, put them down like this, blow out on one cheek, the other cheek, both at the same time. Okay, grimace, frown, and then smile. And you can check symmetry on both sides that way. Christina, a couple questions to ask you. Are you allergic to anything?
Yes.
What are you allergic to?
Sulfa drugs.
Okay, that's very important that you know that about your patients. And do you know in what specific?
No, I don't know.
Okay, so we'll put that down. Are you on any medications?
No.
Okay. You also will ask them personal history, which that is part of it, if they've had any prior accidents or operations, conditions, family history, diabetes, stroke, cancer, hypertension, sexual and social history. Social history would include, do you smoke, do you drink, do you use drugs, recreational drugs. Sexual history could be, when did you start menstruation, how long is your cycle, is it very painful, do you take anything with it, are you married, are you single, are you sexually active with more than one person, have you been exposed to any sexual diseases, stuff like that. And last but not least, at least on this little assessment here, is always try to finish off and turn the patient over. We'll have the side rail up. Because you want to look and see what the condition is under them too. Make sure they're not laying on anything. Make sure that there's not any pressure sores. And she's looking good on this side. And then you also would ask them, is there anything else that I need to know about? You mentioned your pain in your stomach. Could you tell me the pain level for your pain on a scale of 0 to 10, or 1 to 10, 10 being the worst pain? What would your pain be like?
A 4.
A 4? So she's feeling a little bit of pain. So you would ask them questions like the duration, how long have you had it, what caused it, what have you done to alleviate it, or has this happened to you before? Is there anything that you can do to make it better? So you can kind of condense it down before you call the doctor on that little assessment there. So this is just kind of a basic little assessment. Hopefully it'll help you out on dealing with your patients. Thank you, Christina.
Thank you. See if you can answer these questions.